Unlock full pleasure. Raw, beautiful moments with girls who bear it all. No limits, no filters. Just follow the link in the description below and indulge completely.
I begin my Hawaiian full-body massage by ensuring the patient is comfortably positioned on a professional-grade massage table, with the spine aligned neutrally and the head supported by an ergonomic face cradle. The environment is prepared to maintain optimal muscle relaxation. Warm ambient temperature, controlled lighting, and minimal auditory distractions. I wash and sanitize my hands according to CDC-approved protocols before initiating any physical contact. I start with broad, rhythmic effleurage strokes along the posterior chain, from the sacral area upward toward the trapezius muscles. My palms remain in full contact with the skin, applying gentle, consistent pressure equal to approximately the weight of a small book, enough to warm the tissues without inducing discomfort. The Hawaiian technique emphasizes fluid, continuous motion, often described as wave-like, to promote lymphatic circulation and neuromuscular relaxation. Beginners should remember that excessive downward force over the spinous processes may cause localized pain, paraspinal muscle spasm, or, in rare cases, nerve irritation. Moving to the lower limbs, I locate the gastrocnemius and soleus muscles by palpating just below the knee joint on the posterior side. I perform slow, alternating kneading with the heel of my hands, targeting the muscle belly without pressing directly on the Achilles tendon, as this structure is sensitive and prone to inflammation under excessive strain. When working on the quadriceps group, rectus femoris, vastus lateralis, and vastus medialis, I use moderate pressure directed toward the femoral attachment points, avoiding direct compression over the patella to prevent joint irritation. Transitioning to the upper limbs, I apply long gliding strokes from the wrist to the deltoid region, incorporating circular friction on the brachioradialis and biceps brachii. Proper anatomical identification is critical. The biceps brachii tendon can be felt in the antecubital fossa, and too much localized pressure here can provoke discomfort or even transient paresthesia. The Hawaiian method often integrates forearm rolling along the triceps brachii for a deeper myofascial release without resorting to excessive finger pressure, which may cause fatigue in novice practitioners. The dorsal region requires both precision and caution. I identify the rhomboid major and minor between the medial border of the scapula and the spine. Using my fingertips, I apply small, controlled circular movements, maintaining pressure at a level where the tissue yields but does not resist. In the Hawaiian style, this area benefits from synchronized movements using both hands in opposite directions, a technique known for stimulating proprioceptive feedback and enhancing spinal mobility. Overloading the trapezius with high-intensity pressure can lead to tension headaches or muscle guarding. Therefore, I consistently monitor the client's feedback. For the cervical region, I gently cradle the occipital ridge with my fingertips, applying upward traction to decompress the suboccipital muscles. These small, intricate muscles are highly responsive to minimal force. Even light fingertip pressure here can produce significant relaxation if performed slowly and evenly. Beginners must avoid abrupt movements or excessive extension of the neck, as this can strain cervical ligaments. Once the posterior aspect is complete, I carefully assist the client into a supine position. The Hawaiian technique transitions seamlessly to the anterior chain with gliding movements along the pectoralis major and minor, avoiding direct compression over the sternum. For the abdominal region, I apply slow clockwise circles following the path of the large intestine to encourage digestive motility, using pressure comparable to the weight of a folded towel to prevent discomfort or internal strain. The final stage involves the lower extremities once again, now working on the anterior tibialis and quadriceps from a frontal perspective. Here, light vibration and rhythmic compression are employed to stimulate blood flow and restore energy balance throughout the body. I conclude by returning to slow, full-length effleurage strokes covering the entire body surface, integrating the movements into a continuous sequence that reflects the Hawaiian philosophy of interconnectedness. The goal is not only muscular relaxation, but also nervous system modulation, enhancing parasympathetic activation. Overexertion, especially by beginners, is a common risk in full-body massage. Excessive pressure may cause microtears in muscle fibers, bruising, or aggravated joint conditions. The key principles are anatomical precision, pressure modulation, and patient feedback monitoring. Every movement should be intentional, supported by a comprehensive understanding of musculoskeletal anatomy and the physiological effects of manual therapy.
Unlock full pleasure. Raw, beautiful moments with girls who bear it all. No limits, no filters. Just follow the link in the description below and indulge completely. Unlock full pleasure. Raw, beautiful moments with girls who bear it all. No limits, no filters. Just follow the link in the description below and indulge completely. Unlock full pleasure. Raw, beautiful moments with girls who bear it all. No limits, no filters. Just follow the link in the description below and indulge completely. Unlock full pleasure. Raw, beautiful moments with girls who bear it all. No limits, no filters. Just follow the link in the description below and indulge completely.